We're asking GPs to make sure that your patients who are men who have sex with men are vaccinated for hepatitis A. So we're talking about hepatitis A at the moment because we have been alerted that New South Wales has had a number of cases of hepatitis A in very recent months, a significant increase. A number of those have been in men who have sex with men. And there is an ongoing epidemic in Europe and the Americas at the moment of hepatitis A amongst men who have sex with men, and the outbreak in New South Wales appears to be associated with the same strain. People who might be at risk from sexual exposure to hepatitis A include men who have sex with men or bisexual men, or people whose sexual practices may in any way involve the risk of fecal-oral contact. Hepatitis A is a virus which particularly affects the liver and causes inflammation of the liver. Hepatitis A can present with no symptoms, but it can also present with an acute hepatitic picture, fever and malaise, loss of appetite, sometimes abdominal pain, which may be right upper quadrant pain, sometimes jaundice, and particularly easy to see on the sclera. You may get scleral yellowing. And you may also see dark urine and pale stools, and general symptoms of an acute viral infection. So symptoms can take 2 to 7 weeks to appear, but usually appear within 4 weeks. People with hepatitis A should be excluded from work for 7 days from the onset of jaundice, if present, or 2 weeks from the onset of illness. The most important point in prevention is vaccination. Vaccination for hepatitis A is available by prescription, and 2 doses around 6 months apart provides at least 10 years protection, possibly lifelong. An alternative is to give a combination vaccination with hepatitis B and hepatitis A vaccination in the same formula, and that does reduce the overall number of injections required if you are going to vaccinate for hepatitis B and hepatitis A separately. Men can protect themselves from hepatitis A by good personal hygiene measures, and that includes hand washing, especially before food handling, and avoiding sharing utensils when eating. Also using condoms and good hand washing after handling condoms or sex toys, and just trying to avoid fecal-oral contact where possible, and avoiding blood donation during the infectious period. So right now we're asking GPs to make sure that your patients who are men who have sex with men are vaccinated for hepatitis A.